Lecture 1 in this Cantonese series concentrates on basic phrases and sentences used in medical interview, including greetings, OLDCART, medical histories, and so on. So let's just get to it. To ask how you would like to be addressed, you can say, 請問點稱呼你啊? Another culturally appropriate way to ask is, 請問你貴姓啊? Which inquires the last name of the individual. You may then add the formal titles to the last name to address them. For example, if the patient's last name is Lei, you may address them as Lei先生if they identify as male, and Lei女士if they identify as female. To ask what brings you to the clinic today, you can say, 請問你今日咩原因嚟診所啊? And to ask, how can I help you, you can say, 有咩我可以幫你啊? We briefly touched on the formal titles on the previous slide. Here is a list of commonly used titles. To address any adult male, you can say, 先生, prefaced by the surname, like 雷先生. For male elders of your grandparents' age, you can say 公公. For any adult female, you can say 女士, and this is preferable if you're addressing the female directly, prefaced by the surname, like 雷女士. If you're addressing her, especially in the setting of a husband and wife, then you can say 太太 or 太. In either case, prefaced by the surname, like 雷太太 or 雷太. This is analogous to Mrs. in English. For female elders of grandparents' age, you can say 婆婆. And for female between 50 to 70 years old, you can say 阿姨. If in any doubt, just ask your patient how they want to be addressed. You may also use your patient's professional titles, and you can see our workbook for details. Confidentiality is the cornerstone of the doctor-patient relationship. Patient information safekeeping is lax in China. There's no laws such as HIPAA there. Thus, it may be a good idea to assure the patient of the privileged and confidential nature of doctor-patient communication. To translate, I want you to know that anything you say to me is confidential and will stay between you and the physician. You can say, 我想你知，你今日所講嘅嘢都會保密。淨係你同醫生會知. To say that I am not going to repeat the things that you tell me to anyone unless you say it's okay. You can say, 除非你同意，我唔會將你所講嘅嘢話俾任何人知. It is, of course, important to recognize the exception. The only time that I am not bound to this confidentiality is if you tell me that you are being hurt by anyone, or if you are thinking of hurting yourself or others. The Cantonese translation for that can be, 我唯一無法保密嘅情況係你俾人傷害，或者有傷害自己或其他人嘅想法. Alrighty then, the good old OLDCART. The next time your relatives ask whether you're a doctor yet, or ask you about their health conditions, you can impress them with the following questions. To say, how long have you had this symptom? You can say, 呢個症狀你有咗幾耐啦? 症狀 meaning symptoms. Where's the pain? Can you point it out to me? 喺邊度痛啊? 能夠指俾我睇嘛? And to ask, How long does it usually last? 一般痛到幾耐啊? Is it constant or does it come and go? 係持續痛或係斷斷續續痛㗎? Or alternatively, you can say 係持續痛或係間歇痛㗎. Both 斷斷續續 and 間歇, meaning intermittent. Is it mild, moderate, or severe? 係輕微、中等，還係嚴重? Please describe your symptoms. 唔該描述一下你啲症狀. What causes your symptoms to be better or worse? 有咩會令到你嘅症狀好啲或差啲啊? Does the pain radiate to anywhere else? 你嘅痛有冇擴散到其他部位啊? Does your symptom occur in the morning, afternoon, or at night? 你嘅症狀係早上、下午，還是晚上出現㗎? Aside from the open-ended question, please describe your symptoms. 唔該描述一下你嘅症狀. You can also invite the patient to share more by saying, 你可以繼續講, or 能夠講更多信息嗎? Lastly, to summarize what you told me, am I missing anything? You can say, 總結一下你所講啲嘢，我仲爭咩信息啊? And at the end of the interview, you may ask, is there anything else you would like to discuss? In Cantonese, 仲有冇其他嘢你想同我討論下嗎? To transition the interview towards past medical history, you can say, 我可唔可以問啲關於你嘅病史嘅問題啊? Alternatively, you can say, have you been diagnosed with anything? 你有冇被診斷出任何疾病啊? Or, 你患有任何疾病嗎? Sometimes asymptomatic patients may consider themselves healthy, despite past diagnosis. You may prompt an answer by asking, do you have any chronic conditions, such as hypertension, diabetes, or heart disease? And that is, 你有冇任何慢性病啊? 例如高血壓、糖尿病、心臟病. And lastly, to ask whether a patient has regular care, you can say, how often do you see a doctor? 你幾耐睇一次醫生啊? With all that being said, perhaps the simplest way to ask whether a patient has any medical history would be, what medical problems do you have? Or, 你有冇任何健康問題嗎? What medical problems does your family have? Will be, 你屋企人有咩醫療問題啊? To ask about hereditary conditions, you can say, 你屋企人有冇遺傳病史啊? Let's draw attention to potentially offensive terms when asking about your patient's past medical history. If you abbreviate, 你患有任何疾病嗎? Avoid derogatory terms such as 你有病嗎? Or 你有問題啊? Or 你有冇病啊? Do not abbreviate more than 你患有咩病啊? Your patient may look at you incredulously or even stand up and leave, because all of these terms actually stand for, are you crazy? Another issue that might arise in this part of the interview about family history is the Chinese terms for various relatives. There are a lot of them, and not without regional variations. Linked here is a Chinese family tree, but if you have any questions during the interview, you can always ask your patient to clarify. To ask your patient about medication and supplements, you may say, 你有冇食緊任何藥物或者補充品啊? 藥物 meaning medication, and 補充品 meaning supplements. To say how many pills are you taking, how many times per day, you can say, 你一次食幾多粒藥? 一日食幾多次? 一次 means in one occurrence, and 粒 is a classifier of round objects, in this case, the classifier of pills, which are typically round. Are you allergic to anything? 你對咩有過敏啊? What happens when you get allergic? 當你過敏嗰陣，會有咩症狀啊? 症狀 means symptom. You may also want to know a list of common allergens. 青霉素 is penicillin. Gluten is 麩質 or 麵筋. Grains is 穀物. Seafood is 海鮮. Eggs is 雞蛋. Peanuts is 花生. Soy, 大豆. Milk, 牛奶. And nuts, 堅果. Lastly, to round out the past medical history questions, you may want to ask, what surgeries have you had in the past? You can say, 你以前做過咩手術啊? And to ask about previous hospitalizations, you can say, 你以前住過醫院嗎? You're taught in school to use transition sentences for the social history section of the interview. A sample transition is provided here. Now I would like to ask a few questions that won't seem medical related, but will give me a better idea of your life, so that I can give you the best possible care. 我而家想問你一啲問題，唔似係醫學有關，但你嘅回答會幫我了解你嘅生活狀況，咁樣我能夠為你提供最佳嘅護理服務。And to normalize these questions, you may say, these are questions I ask everyone. 我會問所有人呢啲問題。Bear in mind that it may be your patient's first time discussing these issues with a medical provider. Social history is less commonly asked, often due to a busy doctor's schedule, lack of patient's confidentiality, and taboos surrounding these topics in China. These taboos are especially mental health, drug use, and sexuality. Be sensitive, gauge your patient's comfort level regarding these topics, and assure them of confidentiality. The more accurate translation for social history is not what the online translators will show. 社會歷史, which refers to the history of society. For our purposes, and in the interest of a patient's social history, for the patient's medical records, we will use the translation of 個人史, meaning individual person's history. To ask, where do you live, who do you live with, and do you feel safe at home? You can say, 你住喺邊度啊? 你同邊個一齊住啊? 你喺屋企覺得安全嗎? To ask about work, like where do you work, tell me about your job, are you retired? You can say, 你喺邊度做工啊? 解釋一下你份工俾我聽啦。你退咗休未啊？ What are your hobbies? Will be 你有咩嗜好啊？ To ask about the patient's diet, you can say 你平時食咩啊？飲咩啊？ To ask, do you smoke? You can say 你有冇抽煙啊？ And if your patient says yes, you might also want to ask how much do they smoke. And you can say 你一般每日抽幾多包煙啊？ Or 你一般每週抽幾多包煙啊？ The difference is in per day, 每日, or per week, 每週. Now the per week could also be 每個星期 or 每個禮拜。你一般每個星期抽幾多包煙啊？ Or 你一般每個禮拜抽幾多包煙啊？ To ask how much alcohol does your patient drink, you can say 你每個禮拜飲酒飲幾多啊？ And to ask what kind of alcohol, you may ask 你平時飲咩酒啊？ To ask your patient about recreational drug use, you may say 你有冇吸食任何娛樂性毒品啊？ 娛樂性 meaning recreational. If you want to go into the details, you might want to ask your patients if they use marijuana, cocaine, heroin, or meth. Those in Cantonese are 大麻, 可卡因, 海洛因, and 冰毒. Are you sexually active? In Cantonese would be 你有性生活嗎? 性生活 meaning sex life. And lastly, to round out the questions, you may ask, do you have sex with men, women, or both? And that is, 你係同男性、女性或兩者發生性關係嗎? For depression screening, you may ask, during the last 2 weeks, have you been feeling depressed? 最近呢2個禮拜你有冇感到憂鬱啊？憂鬱 meaning to be depressed or heavy-hearted, melancholic. And lastly, have you considered hurting yourself or others? In Cantonese, you can say, 你有冇諗過傷害自己或其他人啊？ And it's only recently that smoking rates in China have decreased. But smoking and drinking rates are significantly high in mainland China. Unfortunately, there is not much study data on the smoking and drinking habits of Chinese immigrants in the U.S. Another term you should consider avoiding is dokban, which literally means toxic drugs. It is a formal term used in government publications in China to describe controlled substances. Dokban has a negative connotation and may cause your patient to not open up regarding their drug use. Controlled substances are heavily criminalized in China, so be sure to assure your patient of confidentiality. Using a less criminalizing term, 娛樂性藥物 or recreational drugs, is better for the medical setting. And this concludes Lecture 1 for Medical Cantonese. There are no conflicts of interest to report. The text, slides, and workbook follow the Medical Mandarin template created by Frank Chi. The Medical Cantonese project directors are Kathleen Trin and Candice Fung. Content and video editing is by Emily Mann Sanchez, with additional help from the members of CMIG at UCLA.